Hi, everybody. You're watching the Jacquie Blaze Show live. Joining me is Senator Matthew Canavan from Parliament, here to talk to us about his speech that went viral last week about ending the lockdowns. He's going to talk to us about why these lockdowns are detrimental to our health and our economy. Senator, thank you so much for joining me. For people at home who don't know what the role of the Senate is, can you state what the Senate does in Parliament?
Well, Jackie, what we do is pass laws. To get a law viable here in the federal parliament in Canberra, it has to go through both houses of parliament. So the House of Representatives is the green place, and I'm over in the red place, which is the Senate. So the Senate is made up of people from all the different states. So I'm a Queensland senator, and there's 12 from each of the states and 2 from the territories. So it's got that equal representation, and that's the idea of having a law having to go through both houses. So it's not just a house, the House of Reps have got mainly people from Sydney and Melbourne, because that's where the population is. The Senate has people more spread across the country. So that's the whole idea and principle. The issue we've had during this once in a century pandemic is there's been very little laws go through the parliament to actually implement the restrictions and lockdowns that have been imposed on people. They have almost all been done by just governments using powers that they already have under legislation that has passed previously.
Why are those governments not listening to its people? I mean, there's such an uproar. I think that's why your speech went so viral and why people are so interested to hear from you. What prompted your speech?
Look, what prompted my speech is the complaints I'm getting from my constituents about how tough it is for them through these remarkable restrictions. I think there was a lot of goodwill last year, and I supported the initial lockdowns because we didn't know how bad coronavirus might be. We had to protect vulnerable Australians, and we had no vaccines or treatments or anything. So that was fair enough. And we all sort of got together. We gave JobKeeper and we tried to help people where we could. Those were laws that did pass through. We did pass laws around JobKeeper. So we helped. But now 18 months in, we can manage this much, much better. And I'm not saying we should let the virus rip. I'm not saying we should just get rid of any restrictions at all. We should do sensible things like not having major events where there's an outbreak, et cetera, but locking people in their homes and forcing businesses to shut, it's just causing such untold damage. And I think what's happened is these chief health overlords have somehow secured themselves, have effectively conducted a coup where they've installed themselves in the position of power. The premiers are just blinded by the lights of their daily press conferences, and so they are just listening to these unelected health officers who get to just do one thing. They're focused on one thing, which is just try and get coronavirus cases to zero, which is impossible. But that's the only thing they're focused on, and they're therefore ignoring and not listening to the mental health impacts that lockdowns impose, the crushing isolation this imposes on children, and the lack of opportunities for them, and of course the thousands of small businesses that have gone to the wall through this. They're just not hearing these issues.
And then clearly not paying any attention to the protests and seeing what's actually really happening. I think that you're right, that those daily press conferences, and look, I'd hate to be Gladys currently. I mean, half the time she looks like she's sleep deprived, and I would be too, trying to make the right decision. And there is an element of we don't know, but I couldn't agree with you more when you say that we need to lift some restrictions. How is our economy being impacted by these restrictions?
Well, it's getting smashed. We've lost a few 100,000 jobs already through the lockdowns, and most of those job losses are concentrated in poorer communities in our society. People in retail, some in construction in the New South Wales or Sydney situation, of course, hospitality and hotels, tourism. They're not necessarily high-paid jobs, and the people that lose their jobs in this situation don't have necessarily big nest eggs or lots of equity in their house to fall back on. And that's another thing that very much frustrates me, is that the lockdowns are being imposed on people who do not bear the cost. The bureaucrats, they've all got a job. Most of our media and commentators, they still go to work. You've got media people there like Lisa Wilkinson on the project, lambasting people for not supporting lockdowns. Well, she's not locked down herself. She's going to her job into a studio.
Right, absolutely.
She's got an exemption for that. And then she goes back to presumably a very nice home in a nice suburb in Sydney, and that's great. And likewise for myself, a little secret, Jackie, I don't mind lockdown myself. I've been stuck here in Canberra for 5 weeks. That's not much fun. But when I was locked down in Queensland last year, I was at home. I got I'm not that well to do, but I've got a nice home. I can stay with my family. That's great. But I feel for people who are locked up in an apartment. They might have a few kids. They might have no support. They might have just lost their job, and they can only go outside for an hour. And there's no science. Like, where's the science to say that you can't go out for more than an hour? Being outside is one of the best things to do during a respiratory illness pandemic. And that's what really frustrates people. But because the restrictions that are being imposed have long since left the planet of sensibility. They're just random things that seemingly governments are playing whack-a-mole trying to do because nothing's working. So they just propose more and more restrictions on people and take their frustrations out on people and blame them for something that it's a pandemic. No one's to blame for it. We've just got to manage it.
Absolutely. And I love that.
China's to blame for it. I should say China's to blame for it, but no one here in Australia is to blame.
Or is it? Or was this man-made? I mean, where do you stand on this whole virus and the vaccines?
Well, look, I think the vaccines are working. I've got my first jab. I encourage others to do the same, but really you don't want to hear from me. Go and talk to your doctor. Talk to them about it. I'm not a medical professional.
Because it is different for everybody.
Yeah, exactly. And I very early on, I support choice. Right? I support people making their own choices in a free country like ours. The virus came from...
How do we get there? How do we get there, Senator?
How do we get to get back to choice?
Yes, because I think that's the problem. You hit the nail on the head when you said people in media, and I hate when people in media, because I've been one of those people. I am one of those people. It's so easy for me to turn around and say, go get your jab. But the reality of it is when we look into vaccines, there is adverse reactions. Not everyone is safe having the vaccine. I understand why parents are infuriated because there's so much talk. And when you look at statistics, it's a double-edged sword. There's evidence for vaccines working. For example, in the USA, there are very low numbers being reported of vaccinated people dying. However, in the UK, when you look at it, and Reuters argued that Public Health England reported 62%, which was false. They said 59% was the correct number. To me, that's such a close discrepancy. 59% of vaccinated people dying is a very large number. And what do we put that down to? Why is the US versus the UK so different?
Well, my understanding of that stat was that 59% of people were hospitalised, not necessarily dying, were vaccinated. And obviously, there's an even higher rate of vaccination in the UK. So as your vaccination rate goes up, of course, you're going to expect more people to be in hospital with a vaccination because that's just what the underlying population has. And look, but I think you're absolutely right that people are different, right? People are different. And very early on in the rollout, I raised the alarm bells over AstraZeneca when the first issues of clotting came up. And I called for a pause at the time and I was pilloried for doing that. And now my position is, look, AstraZeneca is largely safe for people, but there are obviously people with high risk categories, that there are people that have risk of clotting, especially some young women fall into that category. And that's why you should go speak to your doctor before you get a medical procedure if you're concerned about those issues. And that principle of informed consent in medical procedures has served us very well. When you go get an anaesthetic or any type of major drug or medical procedure, the doctors take you through, usually they usually tell you what the odds are. When I was last at the dentist, he told me you got 1 in so many chance of dying from this anaesthetic that I'm about to give you. And you got to make the decision then about whether it's worth it. And that's what we should return to. Now, how we get there, I think, is going to take a few more periods through this school of hard knocks, because unfortunately the media, our politicians, the public health officials have whipped people up into such fear and panic that there is this mob-like mentality that anybody who doesn't get the vaccine is evil and terrible and should be cast out from society. I really worry about the corrosive impacts that's doing to our society. We are built on the bedrock of mutual respect for other people's decisions. And I think I do have some hope, though, that, Jackie, is once we get more experience with coronavirus, which we do not have here in this country, it will become apparent that vaccination itself is not a panacea. We're still somewhat under the myth here in this country that if we all just got vaccinated, we'd go back to COVID zero. That's clearly not going to happen, given that the vaccine does not completely shut off transmission of the virus as we see in
Can
other
we
countries.
talk about?
And so I think when you see like Denmark has just removed all restrictions, all vaccine passports, everything, because they've realised that, hey, look, it doesn't matter so much. Ultimately, if you want to get vaccinated, good for you. As I say, I think it's probably the best decision for most people. But if you don't, it doesn't really have that much impact on other people because the virus is endemic and transmitting anyway.
I love that you brought that example up. Sweden is another compelling case study where they've allowed their public to choose to either get vaccinated or not. They've got 54% of the population vaccinated. They have had cases where people have died. But interestingly enough, while the rest of us have spiked with Delta in August, they're at 0 cases. So I'm not sure if that's just a
Zero
climate
deaths, I think you mean. 0 deaths, isn't it? I think you mean
0 deaths.
rather than cases. Yeah, in Sweden.
Sorry,
yep.
yes, 0 deaths. And I find that quite interesting because, it's either a climate thing or they're hitting herd immunity without vaccinations.
Either way, I don't know. And I mean, I think the problem with the coronavirus is it's humbled pretty much every country in the world. And we're probably about to be humbled. We were very lucky for a long time being an island nation, being able to shut off our borders. That was great. But, it's not sustainable. And so Sweden went through a rough patch last year. But as you say, they've probably got some benefit from that in terms of a level of herd immunity. And as the data shows, the natural immunity, so to speak, from having COVID seems more effective than the vaccines themselves, at least in terms of infection and transmission. But, look, I don't know. The decision about whether or not to let it rip, so to speak, like Sweden did, and manage it and get the vaccines, it's a tough one. Sweden did have elevated fatalities last year. We didn't. But as I say, there's just no easy choices here. This is what angers me, Jackie, is that somehow there's people, including our political leaders, sometimes seem to suggest that we can choose an option which is not going to involve fatalities, which is not going to involve costs, which is going to be easy. That's not the case. As I said, this pandemic came out of China from probably a lab. The world is a tough place. Your political leaders, your governments, newsflash, cannot solve every crisis. Sometimes there are things in life which are hard, and we've just got to manage them the best we can.
I agree with that. Look, I agree that politicians don't have an easy job. I can't help but feel, though, that some of our politicians are using this as a political advantage to, get themselves ahead, and that it's a political game and that some people aren't listening to the public. What sort of changes would you suggest in being able to balance between, being pro-choice and still encouraging people to have that vaccine? Because I feel that just like a little child, if you tell a kid not to do something, they're going to do that. Whereas if we allow a little bit more freedom of choice, I feel people would eventually go to their doctors and get those vaccines, because I've looked into it and I'm sitting on the fence. I have to admit, I wanted the vaccine. I couldn't get the vaccine because there was none available. I have a blood clot, which then, doing research for some of these interviews, I got terrified myself. I think fear is the worst thing that's happening right now. And that's the only thing that I would fault with our current government, is that getting in front of a camera and constantly telling your people, do not leave your house, is not working. It's instilling fear in people. And I've seen and I've heard so many people in our population turning on each other. And you're right. We are a nation that is respectful of one another. And I want to see us get back to that. How do we get there?
Well, Jackie, it's got to come from the ground up, I think. You're right to say some political leaders have used the crisis as a popularity appeal rather than a pandemic management issue. In my own state of Queensland, Anastasia Palaszczuk yesterday disgracefully effectively used kids to blackmail the state. She said that she's not going to open up the Queensland border until every child is vaccinated in Queensland, effectively saying unless you vaccinate your child, she'll keep the border shut and keep people in pain and separated from their families in Queensland. That is disgraceful behaviour. The only way she will change is if the people rise up and email your MPs, get on social media, get your voice heard, because the only reason Anastasia Palaszczuk is doing these things is not because of the health advice. There's no health advice on that. The health advice actually clearly says that there's not that much benefit for children under the age of 12 getting the vaccine. There is pretty much a united front.
In fact, when I looked at cases, sorry to interrupt. When I looked
You
at
go, you
cases
go.
across the globe, kids under 19 are not high risk. There are almost 0 deaths. So
That's right.
for
That's
her to
right.
make that statement is absolutely absurd. And
That's
no
right.
wonder
And
no wonder our truckers are taking a stand because, you know, we haven't had our vaccines yet. As parents, we want to protect our kids. So, of course, people are going to be outraged. I mean, it's just let's focus on adults getting vaccinated because the government's coming across as using kids to meet quota to reach that 51% so that they can get travel passports. Let's talk about these passports.
Well, it's got to
have
come from the ground up
passports.
because Anastasia Palaszczuk is doing this because she thinks it's popular. But if people rise up and show it's not popular, and I think that is happening in Queensland, I think Palaszczuk has misread the mood there north of the Tweed, and she's copying a lot of criticism because she's saying on the one hand, you know, kids under 12 need to be vaccinated to be protected and save their lives effectively. On the other hand, she's made a decision to keep a 3-year-old boy away from his parents for 8 weeks. Because he went down for school holidays at Griffith in New South Wales, been locked there. He's with his grandparents admittedly, so he's safe. But he has not been able to see his mum for 2 months as a 3-year-old, and he's crying on the phone to her. And she won't give him an exemption. But yet now she pops up and says, I'm concerned about children's welfare. What a load of rubbish here. And you made a good point about the truck drivers here. Look, again, we've got to find ways where we can respect people's choices. And yes, the movement of truck drivers during a pandemic, while we have outbreaks in different parts of the country, is a risk. We've just had a truck driver with a coronavirus come into Queensland. But why aren't we in this country finding other ways to sensibly manage this issue, like the rapid tests? Other countries use these rapid tests for people who travel around, and we could much easily more manage this by using it. We do have approved some of those tests, but none of them are approved for self-use. You've got to go to a doctor to have them done. So it's not particularly practical for you in a semi-trailer to be driving into a GP before you cross the border. But these tests are free in the UK, and they can help us get back to a bit more normality where people can travel, people can show that with very good accuracy that they don't have the coronavirus and be allowed in and move, and we can get our goods and keep our economy moving.
Is there a way that you think we can actually strike a balance between opening up some things? For example, in my humble opinion, as a female who likes to shop, Senator, closing down places like David Jones and Kmart who didn't have any cases was so unnecessary. It took away something that people just could turn to when they needed an essential plate or, you know, towels from Kmart.
Well,
just
plus
something
the workers, right? All the people at Kmart and lost their jobs. And yeah, absolutely. I think retail should be back open now. As I've said before, though, of course, we should have sensible social distance regulations, number of people in a shop, et cetera, et cetera. We shouldn't have in, say, Sydney right now, we shouldn't have the NRL grand final and 80,000 people coming along to an event. Sure. Fair enough. You know, those things are sensible. The problem is we've left the land of common sense and we've got all these restrictions that make no sense, shutting down playgrounds, denying people watching a sunset, shutting down all small businesses. And it's just not working, as we can see. So I've been saying for months, let's have some sensible restrictions which don't allow the spread, hopefully, to get too out of control, because we've got to protect our hospital system. And you know, minor restrictions on our behaviour is not going to end the world. We can all do that. I'm not sure about whether masks work or not. They probably make some difference. But again, I'm not going to die in a ditch over that because I've got to wear a cloth mask to go into David Jones. Fine. Let's just get on with life. But the radical restrictions that are being imposed have just such real world, massive costs on people. They just cannot be justified, and they need to go.
I couldn't agree more. And there's so much common sense in what you're saying. I wish that we would see this in more politicians. I mean, in New South Wales, you know, places like David Jones and Kmart and certain suburbs had no cases. Everywhere has been locked down. I would have loved to see the Premier lock down places like the LGAs who had cases and give them support immediately. She took about 6 weeks to give any sort of payments out. No wonder these people came out to protest. And they were quite calm in their protests until police, you know, aggravated them and got aggressive. I think it's humiliating for the entire nation that we've even had to see this. We're going through what I would say is a little mini revolution. I've started open discussion. Thank you so much for coming on, because it's conversations like this that are going to help people out there, the mums and the dads and the everyday people who aren't, being heard by those politicians, who perhaps aren't getting that sleep, who aren't making rational decisions, to listen to people, because the answers are in working together, because we are all one. And by listening to each other, we can actually come up with solutions that work. There isn't necessity for everyone to be in lockdown. Now, as an economist, how would you do it? You're a man of such logic and sensibility right now. We're so grateful to have you. How would you get us out of lockdown? I mean, obviously slowly lifting stuff, but what recommendations do we have?
Well, as you said before, it's a tough position that Gladys Berejiklian is in, or any premier is in. All leaders have, as I said, been humbled by this, but some more humility about our ability to manage things would help. I think you touched the nail on the head before about, you kind of mentioned that we haven't been talking to each other, and one big problem I think we've had as a government is, while we've had the pandemic on, we can't do what we'd normally do and go and talk to community groups as leaders before we did things. So, and I'm not meaning this as a criticism, but Gladys Berejiklian hasn't been apparently out to the worst affected LGAs. Now, maybe that's not possible, given that would be a risk for her and she has to interact with other people in her role. But it's a big issue. So normally, if a government was going to make a decision to shut down businesses across a whole area, they would probably go and talk to those businesses and communities first before doing that, and get a bit of information about what the hell's happening on the ground. That just hasn't happened, and it can't really happen over Zoom because we're all human beings. And so I think one thing that governments need to do much, much more of is that consultation, that communication to people. Because I think if our leaders spoke a bit more to the people who are locked up in their homes, to the people who've lost their jobs, and not just speaking to the scientists and bureaucrats who are far removed from that impact, their decisions might be a little bit different. Because they're not getting that first-hand human feedback, that's really interfering with good decisions. And so I'd find a way, I think we should find a way, if it has to be by Zoom, I suppose it's better than nothing, but find a way to get more of that communication and feedback, because I just don't think our leaders are getting that right now. It explains why Anastasia Palaszczuk, she's on a different side of politics than me, but she's a good politician and usually pretty in touch with people and what Queenslanders want. That's why she's won 3 elections. But she's, I think, made a massive mistake over the past week, where she has proved to be far and away out of touch while letting NRL players in and shutting out normal Queenslanders. That partly, I think that's because she's not getting around. She's not going down to the local shops and talking to people and finding out exactly what they think. And that's what we need to do much more of, to establish that community feel, that harmony that we have otherwise been known for in this country.
Absolutely, because otherwise they're coming across as they're going, she came across as she's going against the truckers and against the people. I mean, the lady that was on TV yesterday who had been down to see her mum, I think it was, that had died of cancer. She just wants to get across the border. I mean, if it was me at this point, I would be driving across that border and copying that fine just to get home, because she's clearly being so affected. Yet to see those, there is such a divide. And I love that in your speech that you pointed out. People, shows like The Voice have an audience, a live audience. Yet there's, single parents in the suburbs who are being locked up with, 2-3 children in a 2-bedroom place, and they can't go anywhere. And the LGAs here in Sydney are one of those places that is so badly affected. I mean, I'm in the CBD. We are in complete lockdown. I'm lucky that I have a home studio that I can work from and a voice that I can use. I don't need to go protest. I encourage people to get on shows like this and to leave their comments. I encourage politicians to listen to places like this and to stop censoring things on Facebook, because that's where you'll find what people think. That's where the majority go to. Whether that information is true or false, I've looked into it. There's evidence for both sides. Politicians still need to listen to people, because if people are scared of having this vaccine, we need to address that. We need to help them come to terms with either having the vaccine or not having the vaccine, because clearly there's going to be people that have, predispositions and won't and shouldn't have the vaccine, because it does spike differently in different people.
Well, I think that's absolutely right, that the worst thing we could do is hector and lecture people who are resistant to getting the vaccine. Again, I think those people that adopt that strategy or think that will work probably haven't spoken to many people who are concerned about the vaccine.
Right.
And this sort of lack of communication is really hurting us. So, yes, of course, some people, maybe all their friends have got the vaccine and they have the vaccine. And so they think anyone who's not getting it is somehow stupid or different. And as I say, needs to be re-educated effectively. Whereas I know I've got lots of friends and family who are concerned about it. I talk to them and they are not silly. They're not stupid. They do a lot of their own research and read it. They do have legitimate concerns. And so the best way is to engage those and deal with those issues. And then ultimately find a way that if even after all that information people still don't want to get it, we get on with our lives. Because, I mean, as you can see with the uptake, the outrage over the people who aren't getting the vaccine is far and away greater than the issue it's going to present, because we are going to get the vast majority of Australians vaccinated. In New South Wales, I think you're already nearly up to 70% of the people with the first dose. So then most likely those people are going to get their second dose, given they've got their first. And that's still growing massively fast. So you'll get to 80% probably at least, probably higher. This is of people above the age of 16, I should say. And we'll be in a good position. And all this palaver and ridicule would have been for nothing. So what are we that concerned about? Let's just provide the information. Most people make sensible decisions in this country. If we treat them with respect, if we treat them with dignity, that is the best way forward, and we'll get out of this.
I think so too. I really do believe that, you know, the vaccines are working. I do see how people are scared of having the vaccines because there's so much talk about them. And I don't disagree with the people not wanting to have them because they feel that that the government is mandating them. Is there a rush for us to get these numbers of vaccines up? I mean, obviously the government is using lockdowns, as an excuse, but is there a real rush to get these vaccines, or can we start lifting things up?
Well, first of all, I don't think we should have the lockdowns now at all for the reasons I've outlined. The second point to make, though, is we do need to get the supply of vaccines up. I mean, we have had an issue of not having sufficient supply, especially of the Pfizer vaccine, for those that are concerned around the issues with the AstraZeneca vaccine. Now, that is changing and changing rapidly. So we have had a huge focus at the federal government level to do that. Obviously, mistakes were made, or we made decisions that ended up in hindsight we could have done differently. But this is always making decisions in uncertainty. You never know how some vaccines are going to turn out and some aren't. But we're fixing those things. With this week, 500,000 Pfizer coming from Singapore. By the end of the year, we'll have nearly 30 million Pfizer and Moderna vaccines coming in. That will fix our supply issues. And then when vaccines are available to everybody, that's when surely we can get rid of these restrictions and lockdowns. I mean, I think they should go now. But once the supply is available, then people can make their own choice. They've got it, they're there. You can come along and get them. And if you don't want to do that, that's your choice. You live with the risk. I do want to say one thing I haven't said, and we've touched on the fear and the panic, which to me is so out of whack with the experience of coronavirus this year. And something that's not celebrated enough is that the fatality rate for coronavirus this year is almost 90% lower than it was last year. So last year, very tragically, 3.2% of Australians who contracted the coronavirus ended up dying. And we were lucky not to have that much coronavirus, but that's still a pretty high fatality rate for any disease. Whereas this year, it's about 0.5%. Now, that is probably because, as you said, the vaccines are working. They're protecting our vulnerable people. And if you're in a vulnerable age group, if you've got comorbidities, in my view, you should think pretty seriously about getting the vaccine, because it clearly works with those groups of people. So last year, when coronavirus got into our aged care homes, it was terrible. Lots of people died very quickly, and we couldn't provide people care because all the nurses were close contacts. It was terrible, terrible, tragic stuff. This year, we haven't had those sort of issues in aged care homes because almost all people, 90% or more apparently, in aged care homes are vaccinated. And so given the risks are 90% lower than they were last year, why are we adopting exactly the same policies as last year? It doesn't make any sense.
I do want to mention something that I found in my research, again, under Public Health England, when they reported that a large number of the people who were contracting the Delta virus were people who were vaccinated. They also reported that the Delta variant was not as deadly as the Alpha variant that we initially experienced. So I think that's part of what's going on as well. All this information is contributing to people out there being very conflicted and very confused. And I think that uncertainty is what's causing that fear. I love that you suggested that people go out and speak to a healthcare professional to get information for themselves. I suggest the same thing. If you have any other comments or you want politicians to address anything other, please leave your comments here, because we have senators like Matt here who are amazing and logical and who are willing to listen. Is there anything that we can do to support you, Matt, in helping government officials realize that perhaps we need to lift restrictions in order for government to now build and rebuild trust with its population?
Main thing you can do for me is don't bother contacting me. I'm on your side if that's what you want. Contact your local MP, contact your local senator, your state government officials, email them, message them. It does make a difference because, as I said, a lot of the restrictions in place have been put there because there's a perception that they're popular. I believe that's changing and changing rapidly. And so the quicker we can make our elected officials realise that they're on the wrong track here, the quicker they'll turn around.
And I think that we'll start some sort of petition here as well to help, voice those opinions of people, because I think that division is what's causing a lot of conflict and a lot of animosity between the public out there.
You're back. Sorry, I got a phone call and it cut out. Sorry, but you're back. You go.
Okay.
I missed your last bit. Sorry.
That's okay. I think, really kind of voicing people's opinion is what's going to, and giving those people a voice is what's going to help people feel more at ease and more comfortable with what's going on, because otherwise we're seeing a real division of our population where, people can't even trust their friends to say that they haven't had the vaccine. Whereas I think it should be an open discussion between everybody so that everybody can make a decision for themselves. And I think it's okay if you don't want to get vaccinated. You don't have to get vaccinated.
Well, the other thing we haven't mentioned, but we've got to fight against these vaccine passports too. That's just
right.
That is just a way to divide our society with medical apartheid. And you've effectively got to wear a green sticker or something if you're in the good class and a red cross or something if you're in the bad class. It's really bad and it needs to go. As I say, I've got my first jab plan to get vaccinated, but I will refuse as much as humanly possible to go to a business that requires me to show my medical papers, to have a cup of coffee or have a meal. I mean, if Qantas require it, I might not have a choice because there's not that many alternatives for airplanes. But if I've got a choice, I will be boycotting any business that requires this. I do not want to see this come in a free society, and I encourage others to do the same, because this is what we can win. Even if there's not a majority of people in favour of that, even if it's just a minority of people that are against vaccine passports in the marketplace, a bit different from here. In democracy, the majority rules. It's a tyranny of the majority, unfortunately. But if 20 or 30% of people, even some vaccinated people, say, hey, look, I'm not going to that coffee shop that requires me to get my phone out and tell them whether I've been vaccinated or not, suddenly businesses won't be able to do that anymore. Because if you lose 20 or 30% of your custom, you'll go out of business. And that's what we've got to do. We've got to unite on this, push back against it, because I do not want in 2 or 3 or 4 years, I don't want QR codes there. I don't want to have any tracking or screening or medical papers required, because we should go back to being a free and open country that we've always been.
We should absolutely return to being a democracy, because right now we're not. The billion-dollar question that I have for you is, does the government have the power once they get people double vaccinated and they have 51% of the population double vaccinated? Does that automatically give them the right to enforce these vaccine passports?
No, it doesn't. At this stage, the government has said we're not going to enforce vaccine passports, but for some very high risk industries like, say, aged homes. And look, I'm okay with that. I understand that situation. Sure. And look, we already do have situations, high risk situations, where vaccines are required. I used to work in a meatworks. I had to get a Q fever vaccine, which is a disease that can be transmitted from livestock. It was a high risk situation. You had to get it. But apart from those things, we have no plans to impose vaccine mandates on your everyday activities, but private companies are free to do that at this stage. My own view is that we shouldn't even allow private companies to do that unless they've got a justifiable medical reason to do so. But look, I don't have that majority support down here for that. So that's why I'm proposing that we need to get a people's movement going to boycott those businesses that conduct themselves in that way. And I think that will have an impact.
I think you're right. And I'm happy to help in any way that I can with all of that. And I'm sure our viewers do as well. What do you think about different countries imposing travel passports? And will we eventually have to comply if that's the consensus around the world?
Well, as I said, I'm an optimist here. I mean, you look at what's happened in Denmark recently. I mean, you can watch on the weekend the English Premier League and see full football stadiums with not really a mask in sight when they've got 30,000 cases a day in the UK. I actually think people will push back against this. That people like their freedoms. They are sensible and common sense about these issues. And eventually we will retake power from the people that have usurped this, use the user crisis to usurp this. Now, we have to bind together to do that. We can't just sit back. You've got to get involved. You've got to get active. You've got to fight for the rights. But I'm an optimist that is what will happen, because the Australian people, as I said, the Australian people have no desire to go back to being a penal colony. We left that long behind us in our history, and I think freedom will emerge again in this country.
I think we're seeing that with the truckers, and I'm so grateful to all those people out there who are fighting, including the protesters. And I know that a lot of people may not be happy with me saying that, but that is truly how I feel, Senator, because it is these people who are standing up in the face of fear to fight for freedom. And I think that the thing that we're fighting against here more than COVID right now is for our freedom. And I'd like to see what happened in Alberta with the health minister standing up and saying that there wasn't evidence towards COVID and that masks shouldn't be mandated and lockdowns should be dropped. And that change was seen there. And we are seeing it across different parts of the world, including Germany. I think we're seeing a big change in Israel as well, with things not having worked with the vaccines so far. I'm not saying that vaccines don't work. I actually encourage you to go and talk to your practitioners, your medical experts out there, whoever you trust. But I do believe that these lockdowns need to come up sooner rather than later. And I don't believe that.
Well, look, one thing I just say is I don't encourage anyone to break the law. And if, it's unfortunate, these blank restrictions on protesting, but that is the law. I don't encourage anyone to do that. What I would like to see our lawmakers do, and what
definitely
would
not. What I am
is if
encouraging
we could find ways where we should find ways where political expression can be made still during a pandemic. And this is the issue here, that our lawmakers have been so blunt, so inflexible, that their dictates are lacking legitimacy with people. And that's very dangerous for any democracy to start going down this route, because a lot of our free and harmonious society is based on the fact that almost all of us abide by the law. We don't have to get penalised to abide by the law. We just do it because it's part of our culture, and that makes for a much more open and free society by having that. And so I really would ask our lawmakers to look. There are people with legitimate concerns about lockdowns, and I share them, and they deserve a way to be able to express that political position through and even during a pandemic. Now, whether that's arranging protests that require masks or social distancing or some type of approval, or doing it in cars or trucks in certain areas. I mean, I don't support locking up major highways. People can die by doing that. But we do it in a way that's sensible. And the fact that there's just no flexibility from our lawmakers is what is causing this division. We need to find a way. It's like expressing your political opinion in this country is a fundamental right. Now, yes, during a pandemic, We've got to maybe be a bit more sensible how we express that right. But let's find a way to let people do that, all right, which is still low risk. Because, I mean, as far as I know, the authorities haven't been able to show us one case that was transmitted at these protests. Now, if you think that they're very against the protests, so you would imagine if there were cases that had transmitted at the protest, they'd be singing them from the rooftops, right? They'd be telling us all about them. That'd be front page news. But they're not there, so I don't know. I mean, outdoor interaction doesn't that high risk, and I'm sure we can find a way sensibly where people can protest, can be outside to do it if they want to, but work together. I mean, look at the Black Lives Matter protests last year. The police were kneeling before them, right, and allowing them to happen. Why can't they work with these protesters and work with other Australians to give them the right to express their political views? It's a real shame that we have been so inflexible about this stuff, and it's causing so much unnecessary division.
I couldn't agree with you more. I mean, these protests, although they shouldn't happen if they're illegal. Sorry, I've lost you there for a second. Are you there?
Yeah. I got you. I think it's restored. Okay.
Awesome. So although I don't agree with anything illegal being done, because we don't want people to get hurt, and we did see a lot of protesters get pulled up by police, that when they came out of the police station, when they were, on camera and journalists asking them questions, you could tell that they were traumatized by whatever happened in there, because they said we would never protest again. There should be a right to a peaceful protest. I couldn't agree with you more. There was so much propaganda from media stating that there would be, this spike in cases because of these protests, and that it really made the population hate these protesters. That's what made me take a stand for them, not because I agreed with them doing something illegal, but because they were actually standing up in the face of fear to voice their opinions, expecting a peaceful protest. Now, I know from people that were there, they said it was all peaceful. Some police were walking with them. It was all well and good. And then in other parts of the protest, there was horrible violence with, police beating up on people beating up on police. I mean, there was even a horse in the Sydney protest that was attacked. It's absolute madness. There was no spike. The virus cannot spike outside, yet the media portrayed this as being a super spreader event, which I thought was absolutely crazy. Thank you so much for suggesting that there should be a place for people to come. I think shows like this are a protest, a legal way of protesting, of using our voice and speaking to politicians who are willing to listen to us, such as yourself, who have reasoning, who can speak to people like, Anastasia or Gladys on our behalf to be able to voice our opinions. I thank you so much for your time, Senator, and so much for your point of view here. I think that, we're so
Jacquie,
grateful to have people like you on.
It was very enjoyable, and thanks for your efforts.
If you have an opinion,
thanks, Jacquie. You have a great weekend.
Thank you, Senator. If you have an opinion that you want to share, please feel free to hit us up. If you like this interview, share it with your friends and family, and please send us your comments. We'll make sure that they get to the right people. Thank you.